Welcome back to the Do More podcast. We're so excited today to have you listening, joining in, whether you're watching on YouTube, listening through Spotify or iTunes, your favorite podcast streaming service of choice. For us, these are just unscripted conversations. We've loved diving deeper and really unpacking the work of the Do More Foundation and its partners and really explaining why we do what we do and how we do it. So, yeah. Today, I'm joined by Jabu. I'll let her explain. I'll let her introduce herself to you in a moment. And we're talking about being informed by policy. And the ECD policy is our policy of choice. For the foundation, it's our guiding document, and we'll dig into that. Thanks for joining me.
Thank you,
Maybe you could introduce yourself to our listeners, just to understand who you are, where you're from, and what your function is within the foundation.
Okay. Hello, everyone, wherever you're watching from. My name is Jabu, as Jess has introduced me. I'm responsible for the young child portfolio in the foundation and responsible for the deep dive community initiatives we are doing throughout the country.
Amazing.
And I'm glad to be here today to share with you our experiences.
Yeah, it's so amazing to have you here. You're based in Malilan, and so to have someone who's in the community chatting with us about the community, it's just very encouraging. And I'm looking forward to diving deeper into the community work. Before we get going on the topic, we usually do a playful, fun intro.
Sure.
So for our listeners today, could you share with us if there was one rule you think deserves to be broken, what rule would that be and why?
I actually have one. Should I share now or later?
Later.
Sure.
So
Okay.
you'll have to stay tuned to hear Jabu's answer, because we all want to know what rule you would want to break. So being informed by policy, is in some ways sounds quite theoretical. Could you break down for us the ECD policy, giving a little bit of context to our listeners about what the policy is? It was ratified in 2015, so it's quite a new policy in a way for our country. Could you maybe give some context to the policy and then we'll talk about why the foundation aligns itself to this policy.
Okay, I actually like your opening line when you said, when you talk about policy, it's quite theoretical, because that's one of the things South Africa is known for, to have beautiful policies. But the challenge comes, when it's time to implement those policies. So for us as a Do More Foundation, really the work that we do in the early childhood development space is anchored on the National Integrated ECD policy that was passed in 2015. And the reason for us to take that stance was because we wanted to make the ECD policy come alive for real children in real communities. So we are trying to implement the policy in its entirety. We're not doing components of it. We are doing the whole policy, all the components or the focus areas of the policy.
Sounds quite ambitious.
I know, it does.
Why?
Because we are just not doing a touch and go kind of development. What we're doing is systemic. So for us to say the policy works, we need to do it in its entirety, to focus on all the focus area and plus more. Because as a foundation, interestingly, we have added other focus areas that are not in the policy, just to complete the picture and to try and implement a sustainable initiative.
The ECD policy has been commented by experts as being world class, as being solid theoretically, but then, as you say, the challenge comes in practice.
Exactly.
And there were key strategic goals within the policy. There were targets, and they were meant to have been delivered. Actually, we were recently part of a review of the policy, and we'll talk a bit about that. I would be curious to know how you've seen that policy in terms of integrating the services it recommends. How has that impacted your community work and the way you organize your teams and the work we do?
Exactly. So I'll actually start by a comment that came out when we did our first, it was our third year implementation assessment in a particular community, actually in Mpumalanga, one of the feedback we got from the partners was how the Dumo Foundation has managed to bring everyone together. So some of our colleagues from the government department said that they were all mandated to implement early childhood development, but they all do it in their various quarters. I don't want to say corners, in
Silos.
their own. Yeah, even silos is a bit, but they do it in their own silos. But they said that the way we are coordinating as a foundation has brought everyone together out of their silos.
Wow.
So for me, I think that's why I really believe in the implementation model of the Dumo Foundation.
Wow.
Because the foundation is playing that backbone role, basically bringing everyone together to say, come, let's do it together.
Wow.
And I think that has been the success of the work that we're doing.
Amazing. I mean, episode 3 of the Do More podcast, we actually spoke about this backbone role. And I think it's so critical to link it in here to show how Do More is offering that coordination service in a way, and coordination function in bringing people together and creating those partnerships. So it's aided partnerships.
Exactly. It has really aided partners to come together to collectively implement this agenda.
And has the policy supported partnership with government? Because I think that's also part of the conversation we've had.
The policy has, and it is well articulated in the policy because it talks about, I know this is a government ethos, if I can call it that, public-private partnership. And actually the National Integrated ECD policy is just that, because it requires various partners to come and make it work. I mean, we have seen government do their bit. We've seen civil society do their bit. We've seen funders do their bit.
Wow.
And we've seen the community as well do their bit. So for me, partnership is an anchor, for the National Integrated ECD policy.
What I appreciate about the policy is that it outlines all those stakeholders and their roles.
Just on that point of partnership, again, as we're implementing the policy, one of the things, because like you said, the policy has well articulated who needs to do what. And some of the partners were not aware, but they truly appreciated when we brought it to their attention. Because whenever we would go to a partner, we would print out that part of the policy that says US Department A, this is what you're supposed to do. US Department B, this is what the policy says. And many partners appreciated that because they said, no, they were not aware. So
something as simple as, just diving into the policy a little bit and workshopping that idea.
And just using the policy as that guiding, tool to say, I'm not saying it.
It's policy says it. You don't believe me, believe the policy. I like that. So the policy talks about, one, an integrated approach. It also talks about a rights-based approach, so founded on the Constitution.
Exactly.
And it all leads towards a basket or a package of services, a comprehensive package of services. At the Do More Foundation, we often refer to that as the basket of services that I suppose we endeavor to catalyze and we put energy and effort and resource behind supporting. Could you explain to the listeners what is the basket of services? You speak about this. It sounds a bit strange. Can I buy it at Checkers? Is it a basket? Like, what is this thing?
Yeah, so I'll just highlight a few examples linked to our basket of service. And basically the basket of service is basically the focus areas of the National Integrated Policy. But of course, like I highlighted earlier, as a foundation, we've added other baskets to enrich, what is highlighted in the policy. So one of the basket of services is around maternal and child health. And you'll ask yourself, but you guys are not health experts. What are you doing in maternal and child health? So what do we do as a foundation? We catalyze partners to ensure that maternal and child issues are addressed in a particular community, but with a focus of children 0 to 5. So we've got partners working with pregnant moms. We've got partners doing programs for parents and caregivers. We've got partners. We also partner with the Department of Health to, support them, do things like campaigns, immunization campaigns, and so that's what we do around maternal and child health, supporting the Department of Health to implement what they are supposed to do, which is give them that support to make it easier, so that their targets can be met. So like as we said in our earlier podcast, that we just don't wake up and dream what to do. We go to the partner to say, what are the gaps? And then we help to close those gaps. One of our other basket of service is nutrition support. So we... like you must be aware, Dumo Foundation was started by RCL Foods, one of the biggest food producers in the country. And it's only right that we support, nutrition. So as a foundation, we support ECD programs that are not funded and they're not registered, which is a gap that I know government would love to support. But because of many resources, because as a foundation, we do not care where the child is. As long as it's a child, we want to support them. So we provide a nutritional porridge that was endorsed by the Department of Health to ensure that, number one, hunger issues are met, that at least once a day the children in those ECD programs have one nutritious meal. And then the next program is parent and caregiver support. We know that there's a lot of things that parents and caregivers do not know in support of early childhood development. And we know they do not do them because they don't want. Sometimes they are not aware. So we have programs where we support our parents and givers on the importance of early childhood development. What can they do within their means? So that's the other program that we do. And then, of course, early learning. Our early learning support is whereby the Dumo Foundation, we will go look for funding. For example, to ensure that teachers get accredited training like your NQ4, NQF level 4. We ensure that learning resources get to ECD programs like toys and books. We get other partners again to ensure that the infrastructure in the ECD centers is safe for children. So our other basket is infrastructure support. Again, the Dumo Foundation does not do all this on their own, but we've got the fortunate... we are basically in a fortunate position to be able to bring more funders on board who will be able to... I'll make an example. We have a very good relationship with Jojo Tanks, who donate Jojo Tanks. As you might be aware, most ECD centers in rural communities don't even have access to potable water. So we make sure that happens in partnership with some of our partners. And may not be able
to fundraise for a Jojo Tank. And
exactly. Exactly, because I remember in some communities where we started, the children would come to the center carrying 2-liter bottles so they can have water supply for the day. So you can imagine, having a Jojo tank. And in other areas, we've also managed to lobby the local municipality to cut in water into those Jojo tanks. Because sometimes you can have Jojo tanks and they're empty. Yeah,
and I mean, we're having huge climate change issues across the country, droughts in various provinces. So more and more, these kinds of resources are going to be valuable to
and then the other basket for us that's quite clear is child protection, which, we work very closely with the Department of Social Development, including SAPS as well, basically to create awareness in communities on the importance of child protection. So, for example, we have a community where we have SAPS has really come, to the fore. They conduct community campaigns. They talk about, children not going to taverns. They talk to parents what they need to do to protect children during holidays, just to keep children safe. So basically, those are the focus areas, like I said, plus more.
Sure. So the ECD policy outlines these categories: infrastructure, nutrition, maternal and child health,
early
parent
learning.
support, early learning, and what I appreciate about the way that these categories work is that there's so many different services and programs and activities that can fit under these categories. It's a really organized way of kind of communicating them, but it also then motivates government to support because it's linked to a policy.
Exactly.
So amplifying the policy, but also giving integrated care.
Exactly. And I think another critical point to mention why, we are saying the model works and it's not just a touch and go. For example, in this community of Nkomazi, we've been at it for 5 years. And that's why we know it works.
Yeah.
And the way we did it, we started in a few communities. We have since expanded. We're in the process of identifying another expansion, which means that it is a long term. It's not overnight.
Yeah.
So, if partners and funders alike must be willing to invest long term.
Sure. ECD, it is a long-term investment game. You're investing in the future over a long time horizon. And I think that's a conversation we're often having in the advocacy space is around not seeing ECD as a once-off drop in the ocean, but seeing that consistency with support and investment.
Yeah, sorry, just one last thing. The other thing I wanted to highlight was, I think it's important, just to highlight the role of partners, especially for provincial government.
Wow.
I mean, the example we've seen in Mpumalanga is that, by forging those relationships, we've seen a beautiful relationship and working so well together with the provincial team.
Wow.
They're ready to support. For example, the Dumo Foundation has recently moved to Bushbuck Ridge. Unfortunately, it's the same provincial team. And we've seen how they are excited also about Bushbuck Ridge.
Wow.
And, we've noticed that if they're on board, it just makes it so much easy for us to do the work. So I just thought it would be critical just to acknowledge them, their effort, how they are ready to work with us and, direct us.
Yeah. So the model everyone gets to play is a participatory model. The idea is that it's inclusive and allows partners to get involved. It has an advocacy element to it too. How do people get involved? Is this something that it's just kept with a few? How do you bring people into the deep dive work?
So basically, when we enter a community, we have what we call a kickoff meeting before anything is done. And the aim of that kickoff meeting, we invite everyone who works with and for children in the community to say, we are the Dumo Foundation. We are here in this community, based on the needs that have been brought to our attention by the already, the local stakeholders. And basically we bring everyone on board from the very beginning and we say, let us jointly formulate an agenda for children in this community. Because in that way, everyone feels, I've got something to contribute, I've got a voice. And then it just makes it easy, going forward.
Yeah.
So I think that's what makes a difference. Don't bring people to the table as an afterthought.
Sure.
Bring people up front to say, what are your views? What are your thoughts?
Yeah.
Where can we start? Because even the identification of the communities, we don't decide. It's the stakeholders that decide that in this particular community, let's focus on the first 5 communities.
Yeah.
And why? Because they're the most impoverished.
Yeah.
They state the reason.
These wards are the focus, for
exactly.
example.
We don't decide that. They tell us why we should and we follow.
Wow.
What they advise.
You raised such an interesting point around the stakeholder meetings and really allowing people to contribute and to a vision, a joint vision, which is very much a collective impact principle. There's also the idea of mobilizing communities, and I think that's part of why you'd have a kickoff meeting is to
Exactly.
mobilize and involve the community, and then respond with a basket of services, right? You respond with responsive services that meet the needs of the community. So
Exactly, because, for example, our basket of services, we know it's not a one-size-fits-all.
Sure.
So what's happening in Molteno in the Eastern Cape will not be exactly what is happening in Rustenburg in the Northwest. So that basket of services is formulated based on the needs of that particular community.
Amazing. Also, yeah, it sits so well in the community development kind of theory to do it that way, to be adaptable, that it's
Exactly.
not just copy paste for
No.
every community, and every community comes with its own geographic context and leadership and history, so lots to adapt to.
Lots to adapt to, yes.
We've recently participated in a review of the National Integrated ECD policy. So the policy was set out with a timeline and a trajectory. There was like a middle kind of halfway mark goal, and then there was the future goal. I think it was 2030, if
Yes.
I'm not mistaken. And the review was just completed. Could you give us some of your reflections and thoughts on where we're at with the policy, and maybe some thoughts on the review?
Yeah, so I'll just start on the review, because fortunately the Duma Foundation started working just at the time the policy was launched. So I think the Duma Foundation is in a better position to share their thoughts on how they see the policy. I mean, how it has rolled out, what has worked and what hasn't worked.
Sure.
And, like you rightly say, that we participated, in some of the review sessions. And for me, what is important, just to commend the DBE for having the review sessions, because
Absolutely.
for me, it shows that they want to hear what the implementers on the ground are thinking, their thoughts, and, what they are seeing on the ground. Because I think when you coming from a national sort of, you might miss some of the real issues on the ground. So I think for me that has been good. And of course, some of the issues we highlighted them because we participated in the review, such as, teacher qualification, which is still a big challenge in the community that, we need to invest more on that. And the fact that teacher qualification training is very expensive. I think in the areas where we work, we've managed to get so many number of practitioners with accredited training is because we've managed to bring funding in.
Sure.
So, it's an area that still need work. Also the area of nutrition, because when you look at government funds certain numbers, what happens to the kids that are not funded?
To be fed.
Which means that, they're not getting nutrition support. I think for me, it's another critical area. I mean, recently in the media, we've heard how some mothers are taking their own lives and they choose to take the lives of their children because they're struggling to meet nutritional needs.
Yeah.
So for me, like I said, I commend DBE for the review. And for me, it's also just maybe an indicator that they'll do things differently by wanting to hear from the people who are on the ground.
I mean, just for some history and context, within the time that the policy has been in motion, action, the function of ECD shifted. So Department of Social Development was responsible for ECD, and was that 2021 when the shift happened. Then the migration happened where the Department of Basic Education became the responsible government department. And why this is important is exactly as you say. They're looking to history to see what is being done, what worked, what hasn't worked, where are the human resources, where are the finance models not working, or where are the bottlenecks, and how can we move forward? Even with, parent support, there's huge feedback around gaps, and infrastructure will be another hot topic, no doubt.
Exactly.
Registration being another hot topic. And so, I think the policy, it sets up such an amazing picture of integrated care. I mean, based on based on world-renowned research, but there's lots of work to be done.
Most definitely, yeah. And, we also appreciate the awareness that's happening. It hasn't reached there, but, the fact that ECD has to be top of agenda. It can't be lip service anymore.
Yeah.
Yeah.
I appreciate that. It reminds me of the concept of political will.
Exactly.
It's not just about talking or writing about this policy. Now we need to see some political action and that buy-in from all stakeholders at all levels, government and beyond.
Exactly.
Great. Is there anything else in terms of the deep dive work and the use of the ECD policy that you would like to share with us or the listeners?
I think for me, what's critical is just for government also to realize that a lot is happening within the country. And I think there has to be a concerted effort to really find out what is happening. What are these homegrown models? Because, there's sometimes a tendency to go and find a model that works in Cuba or South America.
Yes.
I think let's also...
Bright and shiny.
I know. Let's also make an effort to really find homegrown solutions.
Wow.
That work, because there's plenty of them.
Yeah. Amazing.
Yeah.
Thank you
for
sharing with us. And just a huge shout out and kudos to your implementing partners for championing the ECD policy work and the advocacy work that goes with it. Yeah, lovely.
Exactly.
Could you jump back to our playful intro and share with us what rule you would break if you were to break a rule?
So I think for me, sometimes we take ourselves very seriously, I guess because of the pressures of work, life. So for me, the rule that needs breaking all the time is you need to make time for play. We just need to play. Because as you grow up in some quarters, it's like, let's work. There's no time for play.
Yeah, forget the play.
Yeah, forget the play, let's work. So we need to break that rule and let's just play, and our outlook would be so much easier.
Very cool. You heard it from her yourself. There's your invitation to play, to find the fun and take ourselves a little less seriously. Great. Thank you for sharing it with us.
Thank you so much, Jess.
Yeah, please join us for more insightful talks. If you're interested about the ECD policy, we'll put some links below to some of our resources and documents around the policy and around our Everyone Gets to Play model. And please do reach out if this is something you'd like to get involved with, because everyone gets to be a part.
Yes.
Lovely. Thanks.
Playtime.